Hi guys, I'm Adriana, the SPTA. Thank you guys for joining me today. As you read in the title, we're going to be going over our knee brace today. So what this is mainly used for, or what patients use these for post-knee surgeries, like mainly ACL surgeries. So when they come out of surgery, they'll already be in this extension. They'll already be in this brace, so that's why I have it on for you today. What we're going to kind of go over is donning and doffing our brace, some precautions that we need to be aware of, some skin things, and then some red flags, and then obviously being able to take care of our equipment, correct? Alrighty, so let's get started. So like I said, most patients will already be in the brace, so let's go over doffing, so like taking it off. So we have these little buckles here. You can just press these and they'll slide right off. So they'll slide off, slide off, slide off, and there you go, and it's taken off for you. We have these little pads as well to help against like skin irritations and avoiding like any blisters being built up if it's too tight or anything like that. These do come off. So when you come to taking care of the equipment, these come off, and I know it can get a little sweaty, especially in like summertime. We don't want to have smelly equipment, so you can take these off, throw them in the wash. There's also like some fabric spray that people use. They said it works amazing. But yeah, so those are just some things. When we are having this brace on, some precautions or some things we need to be aware of is making sure that our knee stays in an extension, some 0 degrees of extension. Also on this brace, you can lock it in. You can see on the side, like when you start getting more into your physical therapy, you can start bending it, but it will usually be locked at 0 degrees, so it's a good thing to be aware of that prior to putting on the brace. Also, when we're walking around, we want to make sure that we always have this on, so any weight-bearing exercises such as walking or even coming into PT, we want to make sure that we have this on. So there's that for you. So now when we're putting it back on, I'll take this actually out and we can go through from the beginning. So what we're doing, I like to usually lay down. Usually when you take it off, you're sitting down or you're sitting like long sitting or something like this. So it's a lot easier, I think. Less strain on the back. So what we're going to do is we're going to make sure that our leg is straight, that it slides underneath us. And then there's these two little pads here. We want to make sure that it's in line with our medial and lateral condyle of the femur. So it's just going to be right here. If you kind of palpate or touch around this area, you can kind of feel some bony prominences. Those are the areas we want to make sure that those paddings are on. Just because, like I said, you want to avoid those skin irritations and stuff like that. Alrighty, so what we want to do, once those are lined up, right? We're going to make sure that these pads are kind of lifted over so the skin irritation doesn't occur. I like to start in the middle just because it goes a little bit more securely. Sometimes they kind of fall off. So we want to make sure that we just clip it in the middle. We kind of want to make sure that this is nice and snug because when our leg is down, it kind of adjusts to how it's laying down, and when we stand up, the leg does kind of change. It kind of gets skinnier, so we want to make sure that it's nice and tight. These also have this little strap to tighten and loosen it, so if it's easier for you to kind of have one of them loose, like me, before you buckle it in, and then you can tighten it. It could be easier for you as well. I like to do it for this bottom one as well. And there you go. And then it's strapped in. And you can kind of just tighten them and use the Velcro to do so. Alrighty, so there's that for you. This does slide, like I said, so making sure that these straps are nice and tight using these little things that they give you. But yeah, I do have a little bit more of a deep dive on skin. If you want to learn more about how you can do self-assessments and what things to look for. When it comes to using this brace, some things that you want to be aware of is if you see any abnormalities, anything that doesn't look right to you, do not hesitate to reach out to your doctor or even your PT. Better safe than sorry. We want to be proactive, not reactive. So it's important to just be aware of those things. Any increase in pain or any loss of sensation, those are some things that you want to be aware of, or like I said, any abnormalities. But there you go. That's how you take care and put on and off your knee brace. Thank you for joining me. Have a great day.